Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Faiz bin Mohamad from class AS1204_3. Today, I would like to talk about leptospirosis cases in Malaysia. Leptospirosis is a rare bacterial infection we get from animals. It spreads through their urine, especially from dogs, rodents, and farm animals. They may not have any symptoms, but they can be carriers. In most cases, leptospirosis is unpleasant but not life-threatening, like a case of the flu. Leptospirosis is endemic in Southeast Asia, Central and South America, the Caribbean, and Oceania. Malaysia was categorized as a probable endemic country without any available data. Thus, this study was conducted to determine incidence, case fatality rate, and mortality rate of leptospirosis. Leptospirosis is a notifiable disease in Malaysia since 2010, whereby probable or confirmed cases must be notified to relevant health district office. There were 3,665 and 4,457 probable and laboratory confirmed leptospirosis cases notified in 2012 and 2013 respectively. Students consisted about 16.9% of patients, followed by agriculture based on plantation workers, 14.7%. Overall, age standardized incidence rate of leptospirosis in Malaysia for 2012 and 2013 was 29.02 per 100,000. Overall, case fatality rate was 1.47% for 2-year period, and overall age standardized mortality rate was 0.45 per 100,000. Leptospirosis is an emerging public health concern in Malaysia and may pose a significant health impact and burden to the nation in the coming years if not well controlled. So for the symptoms, you usually start showing signs of leptospirosis within 2 weeks, though in some cases, symptoms may not show up for a month or not at all. When the disease does hit, it hits fast. You will get a fever. It may spike to 104 Fahrenheit. Other typical symptoms is headache, muscle ache, yellowish of the skin and eyes, vomiting, diarrhea, and skin rash. Many of these symptoms are similar to other diseases, including the flu and meningitis, so it's important to get tested. To check for leptospirosis, your doctor does a simple blood test and examines the blood for antibodies. These are organisms your body produces to fight the bacteria. If you have had the disease in your system before, the blood test may give a false positive or show antibodies from the previous infection. So, your doctor will likely do a second test about a week later to make sure the results are correct. Your doctor will order a DNA test. It's more precise, but it's more expensive and takes longer, and in many areas of the world, it's not available yet. Leptospirosis can be treated with antibiotics, including penicillin and doxycycline. Your doctor may also recommend ibuprofen for fever and muscle pain. The disease should run its course in about a week. But you may have to go to the hospital if your infection is more severe. Symptoms may include kidney failure, meningitis, and lung problems. You may have to have antibiotics injected into your body, and in every serious cases, the infection could damage your organs. Prevention is the key. So firstly, avoid contaminated water. If you are in a developing country, don't drink the water unless you're sure it's clean. But because leptospirosis can enter through other body openings, it's also a good idea to avoid swimming, water skiing, sailing, or fishing in freshwater areas. Salt water is generally safe. Secondly, keep away from infected animals, especially white rats. Rats and other rodents are the main carriers of the bacteria. Even in the Western world, 20% of white rats may have it. Be careful if you have to handle white rats or come in contact with their habitats. Next, be aware of your surroundings, especially when you travel. In countries with poor sanitation, leptospirosis is more common and may be hard to avoid. So, recognize the symptoms and seek help if you become ill. Lastly, use disinfectant. Bleach, Lysol, acid solutions, and iodine are deadly to the bacteria. Keep them on hand to clean up. That's all from me. Thank you. Assalamualaikum.